Looks like an empty table.
So thank you all.
Go ahead.
Okay. I'm not sure we need the microphone, but we do for the people who may be joining us by telehealth. Welcome to everybody who did brave it out on a rainy May evening. I'm Joan Backman. I'm a psychologist here at the IWK, and welcome to our Psychology for You series. These are monthly public education talks that psychologists present, and we're telehealthed with various sites around Nova Scotia. And tonight's talk is on concussion. And I'm really happy to introduce Kate Randall, who is our psychology resident. And just for you who don't know what a resident is, Kate is a PhD student in clinical neuropsychology from the University of Victoria, originally from northern BC. And as the final step in a clinical PhD, you come somewhere like this and do a full year residency internship program where you get to work in all kinds of different areas and do all kinds of interesting things, hopefully interesting things. And so we're delighted. It's a very competitive process, this match process between students and residency sites. So we're very delighted that Kate chose us and we chose her, and she's been here this year and worked with me on the brain injury team, as well as a number of other placements. And as part of her work, she did do a fair bit of research into concussion management, and is going to be talking about that tonight. We also, Kate and myself, we've developed some brochures for parents, for youth, and for educators about concussion that we're hoping to have available throughout the IWK. And if anybody's interested in looking at those and giving us feedback, we'd love to get your email address and send you them and get some feedback from you.
Yeah, so why don't we'll just leave this maybe at the door, and you guys can give your email address, and we can just email you the brochures just
if you're interested.
Your feedback, if you're interested in that. So that'd be great.
And same thing at home, or at telehealth sites, if anybody's interested in looking at those brochures, if you let us know your email address, we'll make sure you get them. So without further ado, I will introduce Kate, and she can proceed with the talk. Thank you, Kate.
Yeah, thank you. So thanks to all of you that did show. I know it's a rainy day, so I appreciate you being here regardless. And as Joan was saying, I'll be speaking about concussion today. And I'm going to give you some information about what concussion is, just some statistics in childhood and adolescent populations, both in the United States and Canada, what to expect when your child or adolescent has actually suffered a concussion, some information about symptoms, but also information about symptom management and return to school, also return to sport if your child or adolescent happens to be an athlete. And at the end of the talk, just give some information about preventing further concussion and why that's so important. So what exactly is concussion? Well, you may have heard several different terms: mild brain injury, mild traumatic brain injury, mild head injury, minor head trauma. All of these terms are used interchangeably with concussion, meaning that they all kind of mean the same thing. Mild traumatic brain injury is actually the most commonly used term in the general clinical medical literature. So it's going to be peppered throughout this presentation. If I'm referring to mild traumatic brain injury, it's also concussion. But a concussion may be caused by a direct blow to the head, face, or neck, or an indirect blow, so that's somewhere else on the body, that leads to rapid and forced movement of the head. So for example, being shoulder checked in hockey and having your head snapped to the side, even if it's not a direct blow to the head, can still actually cause a concussion. And when you have an impact like this, your brain actually changes directions and moves around within your skull. And really importantly, you actually don't have to be knocked out or lose consciousness to sustain a concussion. So your brain is actually made up of soft tissue and is surrounded and cushioned by blood and spinal fluid. So any sort of rapid movement or rotation of the head can actually shake or move the brain inside of your skull. And I'll show you a little video in a second as to what that looks like. But it can cause damage to the brain through chemical changes in the brain, but also changes in blood flow to your brain. And the biomechanics of concussion actually inform us that some rotational force present can actually facilitate concussion a bit further. So it's not just moving your head back and forth, but if there's some rotational force present, that actually is a big factor in sustaining a concussion. And of course, our brains are really important because they help us do everything from walking and talking to breathing, eating, and sleeping. So any damage to our brain can result in a variety of different types of symptoms. And so I'm just going to pull up this little video here so that you guys can see just a little clip on what it can look like when your brain.
In a severe impact to the head, the brain moves and hits the skull, causing injury. Here, during a boxing match, the brain moves from side to side after the impact of a punch. Following a concussion head injury, confusion and disorientation due to temporary distortion of the brain may result.
So as you can see, the brain does move around inside of the skull there. Just a quick little clip to let you see what that looks like. There are a variety of common causes of brain injury, things like transportation accidents, for example, bicycle or motor vehicle accidents. Sports injuries are quite common, falls, but also concussion or brain injury can result from abuse or assault as well. In terms of just some immediate symptoms, so right after a concussion, your child or adolescent may have experienced a variety of symptoms, such as a change or loss of consciousness, headache, maybe some vomiting or nausea, difficulty remembering the event that led to the concussion, dizziness, double or blurred vision, or feeling dazed, disoriented, or confused. So there's a variety of different symptoms that can occur, but they don't necessarily all need to occur. And just some different facts about concussion. Some of these were obtained from the Brain Injury Association of Nova Scotia website, which is actually provided in your resources at the end of this talk. But a concussion actually occurs every 4 minutes in Canada, which is really quite frequent. And this isn't just specific to children and adolescents, but to the general population. And a third of youth will actually have a concussion before they leave high school. So it's a pretty high statistic. The annual rate of concussion is actually fairly unknown, and this is due to a variety of things. One is kind of widely varying definitions, but also underreporting. So just because you've sustained a concussion, you may not know it, you may not go to your family doctor or into the emergency room, and therefore nobody really knows that that's ever happened because it's not really reported in any type of place where we're going to get a statistic for it. So in the United States, they estimate about approximately 500,000 children under the ages of 14 and younger sustain traumatic brain injury annually. And this isn't just specific to concussion, but a variety of different traumatic brain injuries. So brain injuries are actually graded in terms of their severity. So we have mild, moderate, and severe. But the most common type of brain injury is actually a mild traumatic brain injury or concussion. So up to 80 to 90% of children ages 14 and younger that suffer traumatic brain injuries and seek medical attention, that being the key, are actually classified as mild traumatic brain injuries or concussion. And the ratio of this mild to moderate to severe is actually 8 to 1 to 1. So again, that mild really being the most common. So it's a really big concern. The Pediatric Acquired Brain Injury Community Outreach Program is a joint program with the Children's Hospital of Western Ontario. It's in London, Ontario, and the PABICOP is just the acronym for it there. But they actually put out a recent study in 2010 looking at referrals from 2 years prior to this actual PABICOP program. And what they found is just in the past 5 years, in general, concussion referrals have actually increased substantially, and that males are actually more likely than females to sustain concussions. But they also, the program looking at these past 2 years indicated that youth in the 13 to 18-year-old age group were at the highest risk for sustaining concussion and for having ongoing and complex problems as a result of their concussion. And furthermore, despite more males than females actually sustaining concussion in all age groups, the ongoing and complex problems were more prominent among females than males in this 13 to 18-year-old age group. So this is really important to kind of understand the trends and how we can identify them and also just help support the children and youth that are suffering from concussion. So looking at some different statistics for Canada, the incidence at any one time is approximately 90,000 traumatic brain injuries survived every year, the incidence every year in Canada. The prevalence, so at any one time, is about 590,000 traumatic brain injuries in Canada, so quite a few. And for children in Canada 15 years and younger, the incidence of traumatic brain injury is approximately 180 per 100,000 children per year. These are some older statistics, so back in 1996, the census data, but it looks at the total Canadian mild head injuries, which were about 30,000, and of those, approximately 7,000 were in the pediatric range. So it's certainly a large public health issue. In terms of diagnosis, so in comparison to moderate and severe brain injuries, mild traumatic brain injuries or concussion are often more challenging to diagnose. And this is often due to just quick resolution of symptoms. So often they may not report them, or the symptoms resolve really quickly, or there is no really real objective evidence of injury in terms of brain scans. So another problem with diagnosis of concussion is this lack of a universally agreed upon definition, and it kind of contributes to the diagnostic challenge. So concussion is actually diagnosed with a combination of physical and neurological exams. Back in 1993, the American Congress of Rehabilitation Medicine was the first organized interdisciplinary group to advocate for four specific criteria for the diagnosis of mild traumatic brain injury. And then in 1997, the American Academy of Neurology published a definition of mild traumatic brain injury with different grading systems. But the World Health Organization stepped in 2004 with a collaborative-centered task force on mild traumatic brain injury, and they advanced a standardized definition, which is used much more commonly now in the literature. So in doing so, they really acknowledged that the definition was derived from these previous definitions. But the definition that they proposed was that to actually have sustained a concussion, it would require one or more of the following. So confusion or disorientation, a loss of consciousness for 30 minutes or less, post-traumatic amnesia, so not remembering the event or events afterwards for less than 24 hours, and or other transient neurological abnormalities such as focal signs, seizure, an intracranial lesion, but that did not require any sort of surgery. In addition to one or more of those, the Glasgow Coma Scale score had to be 13 to 15 after 30 minutes post-injury or later upon presentation for healthcare. And the reason it's or later upon presentation is that you're not necessarily going to be assessed 30 minutes after your injury. It's going to depend on when you actually get to see a physician or if you're taken into the emergency room. So in terms of what the Glasgow Coma Scale actually is, it looks at a variety of different features, eye-opening, a verbal response, and the best motor response an individual can give when assessed. And they're graded, so the higher the score, the better they're doing, up to a total of 15 out of 15. So in terms of just looking at symptoms of concussion, well, people who have suffered from a concussion may experience some or all of the following post-concussion syndromes. These symptoms are actually quite common, and they may appear in the first hours to days after injury. And in fact, some youth may not even notice them until they get back to their regular routine. So back to school or back to work, and then they notice that things aren't quite the same for them. But these symptoms really help remember to just slow your body down and let your body rest as your brain recovers from concussion. And they typically fall into 4 different categories. So physical symptoms, cognitive or thinking types of symptoms, behavioral or emotional, and sleep. And we'll get into what exactly these symptoms look like. So in terms of physical symptoms, feeling tired or fatigued or having no energy is actually the most common symptom that people report after a concussion. Headache can also be common, balance problems or poor coordination, dizziness, maybe fuzzy, blurry, or double vision. They may find they're more sensitive to noise or light. They could have a ringing in their ears, or they may suffer from some sort of stomach ache or pain or feel nauseous. In terms of cognitive symptoms, so things like thinking and remembering, children or adolescents may have difficulty thinking clearly. They could feel foggy or dazed. They may just feel slowed down in general. They may have slower responses to questions or directions. Attention problems can also be quite common, so difficulty concentrating or focusing, being easily distracted by things in their environment or noises, having difficulty remembering new information, perhaps in school, general confusion, trouble remembering what happened before or after the injury, difficulty making decisions or planning and organizing their time, or making mistakes that they wouldn't commonly make prior to their injury. And in terms of behavioral or emotional symptoms, it's often very common for children or adolescents to report increased irritability or grouchiness, a decreased frustration tolerance, and angry outbursts, so having just any little thing kind of set them off and having difficulty controlling their emotions or behaviors when they're feeling angry. As well, sadness can be common, perhaps more emotional mood swings or having strange or inappropriate emotions that don't really seem to fit the situation, maybe being nervous or anxious, acting without thinking, so being kind of impulsive with their behavior. They may report, or their families may report, some personality changes, and they may have a loss of motivation or apathy, which essentially just means a lack of interest in activities that they did maybe previously enjoy. And last but not least, sleep disturbance. So this can present itself in different ways, perhaps sleeping more than usual, sleeping less than usual, or having trouble falling asleep. So different types of sleep disturbance as well. So in terms of the outcome of concussion, what you can actually expect, well, in the majority of people who've experienced a concussion, symptoms really do decrease quickly within minutes, hours, or even days after their injury. And most people who do suffer a minor brain injury or single concussion actually recover quickly and completely, typically within 7 to 10 days after their injury because the damage is minor and their brain heals. However, recovery can be slower for children and adolescents, and this is because their brain is still developing. So an insult to the brain during a younger age range can result to a longer recovery period. So what's really important that children who have had a concussion in the past, it's important to understand that they are actually at an increased risk of having another one, and these children may find that it takes longer to recover if they have suffered from multiple concussions in the past. And we'll talk a little bit more about the factors that do contribute to recovery in a minute. But the take-home message that I really do want you guys to leave here with is that for most people that have suffered from a concussion, they will recover fully without any permanent or long-lasting symptoms. This is the most common outcome, that people do recover fully by 3 months after their injury and really feel back to their normal level of functioning. However, for a small number of people, approximately 10% of those that have suffered concussion, the symptoms don't resolve for weeks or months after their injury. And if the symptoms actually continue beyond 3 months, this has been referred to as persistent post-concussion syndrome. And in fact, there's no cure for it. The main treatment is rest, both physical and cognitive or mental rest. And the real best thing to help recover is to learn about the injury, but also to take steps to help manage symptoms until you feel back to normal. So it's great that you guys are all here today to learn about concussion and to educate yourselves on how to manage the symptoms. There are several sets of diagnostic criteria that actually exist for persistent post-concussive syndrome, and many are defined by the specialty of the physician, but also the clinical setting or maybe the research criteria, whatever they're tending to use. The American Psychiatric Association proposed a research criteria, and they defined this persistent post-concussion syndrome as some measured decline in cognitive or thinking ability, a report of 3 or more symptoms of mild head injury that we just talked about previously, and that the symptoms must be present for at least 3 months. But there are a variety of different factors that can help predict recovery, as I was saying earlier, from brain injury, and how symptoms are actually going to present themselves. And this table here outlines a bunch of them. So in 2008, there was a consensus statement on concussion, specifically with regards to sport, but this really kind of is important, I think, for anyone that has suffered from concussion, and what kind of factors will contribute to how quickly they recover and if they will even acquire this persistent post-concussive syndrome. So the consensus panel agreed that there are this range of kind of modifying factors that can influence the investigation and management of concussion, but in some cases they can actually predict the potential for these prolonged or persistent symptoms. So for example, just looking at symptoms, of course the number of symptoms can be a factor, how long they've experienced symptoms, so more than 10 days, and how severe the symptoms are. The more complicated the injury, the more likely it is that you're going to experience symptoms, and the longer it's going to take to recover. But this is not the only relationship that contributes to recovery. So it's a factor, but it's not, the severity of the injury is not the only thing. Looking at some signs, so looking at loss of consciousness in particular, prolonged loss of consciousness, so what they outlined was greater than 1 minute in duration, would be considered a factor that can modify management. But also looking at amnesia, published evidence suggests that the nature, burden, and duration of the clinical post-concussive symptoms may be more important than the presence of amnesia alone. So again, a factor, but not anything that's going to be a real major factor in recovery. There can be concussive convulsions that can be problematic following concussion, but again, not a major factor according to this panel. Looking at some of the temporal factors, so the frequency, so having repeated concussions over time can really be a big impact. timing, so injuries that are close together in time, and also recency, so having a recent concussion or traumatic brain injury, and we'll talk a little bit more about that in a bit. But also looking at thresholds, so having these repeated concussions occurring with progressively less impact or force or slower recovery after each successive concussion. So really what it's important to know here is that each time your brain suffers a trauma or injury that leads to damage, your brain really becomes more fragile. So the threshold lowers, and therefore even a small hit to the head can result in a concussion. So this threshold just gets lowered the more concussions that you have over time. So recovery from a single uncomplicated concussion is usually quick, whereas concussions that happen multiply can lead to more symptoms and a longer recovery period. So again, if you've suffered a concussion in the past, it's really important to learn about how to prevent one in the future and take steps towards that. The age of injury, again, as I mentioned earlier, is also a factor. So children and adolescents can take longer to recover from concussion than adults. And it's really important, especially with adolescent athletes or child athletes, that they never return to play on the same day, regardless of whether or not it's for sure that they've had a concussion. So again, if there's any concern that their concussion could have happened, absolutely should not return to play the same day. And in fact, we'll talk about it a bit more, but not returning to play for at least 1 to 2 weeks after their symptoms have completely resolved. So really, really erring on the side of caution with children and adolescent athletes. Looking at co- and pre-morbidities, so things that were happening prior to the injury. So learning and behavior before brain injury. So if you had any sort of learning or attention or mental health, behavioral or sleep problems before the concussion, having concussion can actually make these problems worse in many cases. And in terms of medication, what medication can do is actually mask symptoms. So it's important to know, especially in athletes or in consideration of returning child to any sort of high-risk activities, if they're taking any medication and these medications could be masking their symptoms, it's important to know that and to make sure that they're not returning when they're still experiencing any symptoms, regardless if medication is helping them out or not. And it's also, of course, behavior plays a role. So dangerous styles of play, engaging in kind of risky behaviors, but also the types of sports that children may be involved in. So high-risk activities, contact or collision sports, and high sporting level. So how often they're actually playing these kinds of sports can be a factor. The role of female gender was also considered a modifying factor here. They decided not, the panel as a whole decided not to really put it on, as they didn't feel that there was enough evidence to support it. But it's certainly been brought up in a few studies that and it's certainly in the PABICOP study that we looked at in a little while ago, that females may be at an increased risk for suffering concussion or for having increased problems following concussion. So it's a factor, but there's not enough research to really support it at this point. There are a variety of other contributing factors as well. So having any sort of history of stress or pain, so experiencing a lot of stress or chronic pain or headache can make the healing process slower or longer, which is probably no surprise. But also family expectations and functioning. So it's really important that the family understand the effects of concussion so that everybody can work together and be patient to understand and manage the symptoms of concussion. Motivational factors can also play a role. If a child or adolescent engage in any sort of litigation, it can prolong the recovery period. Certainly we know that that's the case in an adult population. But also looking at post-injury management. So it's important to really be educated about how to best manage symptoms, and the more educated you are, the better able you're going to be able to manage those symptoms and get better quickly. Something to note here too, though, is in terms of post-concussion symptoms, they're actually really common in healthy individuals. So as we were going through those different slides, looking at the different areas of symptoms, you can probably note that some of them, you can find in different populations of people, those that may be suffering from some sort of chronic pain, maybe some mental health illness or behavioral problems. So they're certainly not specific to a concussed population, but even in a general, normal, healthy population, people can report these symptoms. Headaches, having difficulty sleeping, things of that nature. So it's not just in a concussed population that you see these symptoms. And that's just important to note there. So now we're just going to get into some ways to manage concussion. And recovery is really different for everybody. So it's important to listen to your body and know what the symptoms and warning signs are for you so that you can slow down and help your body and brain heal during the process. And if any of those symptoms do return, that you should have your child or adolescent seek medical attention and only return to physical activity with a doctor's permission. Because returning to risky activities while still experiencing symptoms can really increase that risk of further concussion and lead to long-standing symptoms and or other injuries. And a big thing in terms of really not wanting to return to play with any symptoms present in your child and adolescent is the possibility of this second impact syndrome. And it's a condition where the brain swells rapidly and catastrophically after a person suffers a second concussion before the symptoms of that first concussion actually completely resolve. And this deadly second blow can occur days, weeks, or minutes after initial concussion, and even the mildest grade of concussion, so even the smallest hit to the head, can actually result in the second impact syndrome. The condition is often fatal, but it is very rare. Most of the cases that have been reported have occurred in an adolescent population, and young athletes have been reported to be at the highest risk. No surprises there, given that, again, if you're not sure you've had a concussion and you return to play immediately or even within days before your symptoms resolve, of course you're at an increased risk of this second impact syndrome. So things like football, hockey, boxing, or skiing, where you would be at a high risk in these types of collision sports. So just some management things that you can do. Rest is really the most important strategy to help the brain heal and recover. And rest means taking a break from both physical, but also from mental or thinking activities. So take naps when you feel tired or when your child feels tired. When the brain's injured by concussion, it requires energy to heal, and because of that energy being used up in the healing process, there's actually less energy available to your child or adolescent during the recovery process. So it's important to conserve their energy so that they're not kind of crashing and they're using up all their energy during the day. So it's really important to schedule these breaks during the day, and of course taking breaks if they're feeling tired or spacey. It's also important to limit physical and mental activities, especially those that are going to require a lot of thinking or concentration or that are going to put them at increased risk for a second concussion. So physical activities include gym class or sports practices, even weight training or running, and thinking and concentration activities include homework or classwork, but also video games or any other kind of job-related activities, anything that's going to be really using that mental power. And we always recommend a gradual return to activities. So gradually returning, and then if the symptoms do increase or worsen, to back off again and take that rest period. And above all, just to be safe, so really avoiding these high-risk activities where you could sustain a concussion when you're still recovering. Mary Ann Kendall is an occupational therapist from the Pediatric Acquired Brain Injury Community Outreach Program, and she proposed these 3 Ps to help out with energy conservation, which I think are really great and a nice way to kind of remember how to conserve energy while you're during the healing process from concussion. So in terms of prioritizing, it really means deciding what are the most important things that I'm going to do each day and when should they be done. So of course starting with the things that need to get done first or that are due first, and also scheduling them during times of the day when you're going to feel at your best. So if you're most alert in the beginning of the day, you want to schedule activities for those times of day. And pacing means switching between resting and completing activities. So the goal is really to be productive without increasing symptoms, so you can be as effective as you can be while you're recovering. And resting can be sleep, but it can be any restful activity. So taking a bath or listening to music, whatever you find restful and relaxing. And really the best way to pace yourself is to take short rests often and before you feel tired. So you're not constantly chasing that tired feeling. Because of course, if you go too long without a rest, you can use up all your energy and it's going to take longer to recover than if you take little rest breaks throughout the day. And planning ahead. So planning for your day or week can be helpful because you're probably not going to be able to get as much done as you typically would have been able to before concussion. So it means you're going to need to take a break and break things down to smaller parts, doing one part at a time, and planning when you're going to do each part as well. So using checklists can be helpful to break large jobs down into smaller parts, but also using a monthly or weekly calendar to plan and decide which steps you're going to take and when. And trying to spread out tasks as evenly as possible is also important to maximize what you can accomplish without draining your energy. And it's also really important to practice good sleep habits for anybody that's recovering from concussion, but specifically if you're having sleep issues as well. So really trying to get the best sleep possible at night. So setting up a routine where you're going to bed at the same time every night and you're getting up at the same time every morning, even on weekends. Avoiding any food or drinks with caffeine. Avoiding stimulating activities approximately 1 to 2 hours before bedtime, but also ensuring that there's no electronic devices in the bedroom that can really be distracting and make it difficult to fall asleep at night. So television, computer, cell phone, removing all those from the bedroom when you're going to go to sleep at night. But also paying attention to nutrition, so avoiding, again, caffeine, but also avoiding alcohol and drugs for an adolescent population because, for any population that suffers a concussion, because the impact of these can actually be greater on a damaged brain, so it's important to avoid those. It's also important to just allow your child extra time to complete activities. So if your child is slower when finishing tasks, to really allow them more time than usual and make sure they don't feel any pressure to get things done quickly, to monitor their symptoms and take breaks if their symptoms are increasing. Providing them with more chances to learn as well. So if remembering things is difficult or focusing or paying attention, to really allowing more opportunities to learn and repeating things if necessary. But above all as well, to be patient. So remembering that the brain does need time to heal and that symptoms will recover, but it takes some time. In terms of managing mood symptoms, increased irritability, crankiness, or grouchiness is quite common in the populations that we see, particularly that have suffered from concussion or mild traumatic brain injury. And it's important to know that this behavior is likely caused by the concussion. So it's important to be patient and understanding when it happens, and to just try and look for triggers of the behavior and see if you can notice a pattern. So thinking about what might precede or come before the behavior. Do you notice a pattern? And is there something that you can actually change? In terms of strategies specific to youth or adolescents to manage anger and frustration, knowing when to take a break. If you're feeling angry, to be able to remove yourself from the situation and take a break, take a few deep breaths, or actually figure out a quiet or safe place that you can go to calm down and relax when you're feeling angry. Especially identifying a place at school can be really important if it's becoming a difficult problem at school for you to manage these symptoms. And now we're going to get into return to school. So it is quite common for children and youth to stay home for at least the first few days after their injury, and we really recommend a gradual or slow transition back to school is the best plan. So for example, having your child or adolescent try and go only mornings or afternoons for the first few days, and then slowly incorporating more time into school until they can attend full days without worsening of symptoms or significant fatigue. But it's also important to keep in mind that too slow a transition or return to school can lengthen their recovery period by causing them stress from falling behind or being away from their friends or even disrupting their daily routine. So it's a bit of a delicate balance in kind of knowing your child and also monitoring those symptoms and figuring out when is the best time to get back into school full time as well. So when your child is actually able to return to school, again, that gradual transition can encourage their feelings of success, but also reduce their feelings of being overwhelmed or frustrated, especially when they're continuing to experience symptoms when they get back to their regular routine. So while they're recovering from their brain injury, it's really important to establish this school-based system for monitoring their performance and to put in place adaptations when needed, and we'll talk about what those can look like as well. And this system should really be put into place to identify any consequences of their injury, to prevent academic failure, but also to ensure your child has the support they need to succeed at school. So in terms of the school monitoring system and what it can look like, what you really want to do is notify your child's teacher, the school principal, any other important school personnel about your child's brain injury, their current condition, and also their prognosis, so what people can expect in terms of outcome in the future. And this is going to let school personnel know what to expect and allow them to track and monitor your child over time and their performance while they're at school. So there's just some helpful tips for communicating with the school. So we really encourage parents to communicate or encourage communication between their child's healthcare professional and educators, but also to discuss any injury and concerns with teachers, so knowing what's going on and having teachers aware of that, sharing information and observations about their progress and what your child or adolescent may be having difficulty with, and also to have a scheduled meeting with staff to review any warning signs or changes and any new supports that may need to be put in place, but to also develop a real short-term plan to help your child while they're recovering from these symptoms. And there are certain red flags that can pop up that can notify school personnel that your child is experiencing difficulties with return to school. And these can include things like unexpected absences or school refusal behaviors, maybe absences from specific classes. So attendance can be a real red flag. Also things like cognitive and academic performance, so maybe difficulty paying attention in class, lowered performance from previous functioning, difficulty concentrating or focusing in class, difficulty shifting flexibly between activities, trouble remembering new information or organizing and planning their time, understanding assignments, again, slowed performance or delayed responses. Also, there's some social or behavioral performance flags, so things like unexpected peer conflict or inappropriate or impulsive behavior, being disrespectful towards school personnel, or excessive moodiness or mood swings. But also increased symptoms during schoolwork or homework can be a real red flag that they're maybe doing too much too soon. Looking at the different school supports that are important, it's important really to establish a contact person at school for your child that they can access if they need help or they need to take a break during the day. It's also important to talk about any worries or stresses with your child. So if your child is someone that isn't very good at advocating for themselves and is not going to be the kind of person that's going to go and talk to their teacher about their problems, to really have that conversation with your child and know the problems that they're having so that you can be an advocate for them. It's important to allow rest, but again, to maintain that schedule. So we want your child to be able to have rest during the day, but know that it's important to keep this structured schedule, so similar to what would be expected for them while they're full-time back at school during the week. It's also important that your child not be expected to catch up on all the schoolwork completed in their absence, and this can happen sometimes, so it's important to advocate on their behalf with school personnel, but also to make sure that additional assistance is provided to help them successfully complete any makeup work that they missed when they were gone, suffering from their brain injury. And also, if your child experienced any difficulties in school before their injury, it's very common that a concussion can make these difficulties even worse. So it's important to monitor for increased problems and again put in some adaptations and modifications if needed. And this is where we're going to get into specific ones that can be put in place, again, as needed. So it's important to establish with school personnel what is needed for your child if they're experiencing any academic or social difficulties. And a few temporary informal adaptations really should be all that's necessary. However, if problems or symptoms do continue, then maybe a plan can be put in place for these adaptations to be kept up with for months if necessary. But as long as they're in place and to support your child while they're still experiencing symptoms, it'll be important. And again, it's really not a prescriptive list. These are adaptations that can be put in as needed according to what feedback you're getting from your child's teachers and the school. So things like reducing the homework load and assignments, increasing the time that they are allowed to complete assignments or tests or to respond in class, not placing any time constraints in tests as they can be slower to respond, providing extra assistance to help them remain organized, so things like a planner or a calendar, providing them with access to teacher or peer notes so they're not having to quickly jot them down themselves, perhaps providing them with an assignment book or planner to keep track of assignments, and also having a schedule with places, times, and people involved in meetings written down for them so they don't have to remember them off the top of their head. Other adaptations can be daily meetings with the teacher, and this can really encourage the child to start notifying the teacher of any increased problems that they're having, but also can make sure the child understands what they're expected to be doing when they're going home in terms of homework. Rest periods and breaks can be scheduled throughout the day at school, making sure that they have very clear expectations of what they're supposed to do with tasks, as well as breaking them down if it's needed. Delaying standardized testing. We don't want children to go through any standardized testing while they're experiencing symptoms of concussion. If the child is having difficulty with attention or focus, perhaps providing with preferential seating, so at the front of the class where they're not going to be as distracted by other people or noises in the classroom. providing indoor recess if needed, and this is really to reduce the risk of injury, but also some strategies to cope with sensory sensitivity if needed. So if your child or adolescent is having difficulty with an increased sensitivity to noise or light, perhaps leaving a noisy classroom for a few minutes, or eating at lunch in an alternate location if the cafeteria is very loud or noisy, leaving the class 5 minutes early to avoid those busy hallways, perhaps using sunglasses if they're sensitive to light, or using an MP3 or earplugs in class while they're completing schoolwork to really block out that classroom noise, as it can be very distracting for some children. In terms of return to school, it may be helpful to provide an explanation to school peers about the short-term consequences of concussion, and maybe provide counseling to peers to ensure that they understand any impulsive or socially awkward behavior that can result in the child or adolescent that suffered from a concussion. And if the child has suffered from a concussion during the summer, it's also very important to discuss the issues with the school principal and ensure that the new teacher in the fall discusses the child's previous level of functioning with the teacher, so that there's communication going on if there are any changes that have occurred in that return to school in the fall. Now we're going to move into concussion in sports. So, as I was mentioning earlier, if your child's an athlete, they should always be removed from competition or play after concussion and not be allowed to return to play or practice until they're fully recovered. It's important that if there's a suspected concussion during play, that they're not left alone, and they should be monitored for any symptom deterioration. They should be evaluated by a medical doctor, so either a family physician or bringing them into the emergency room. And also to restrict high-risk activities for at least 1 to 2 weeks after their symptoms have completely resolved. And I'll talk about this gradual return to play in a minute. So numerous return to play guidelines do exist. None are really based on scientific evidence, so I can't really endorse anything here, but I'll talk about some of the specific guidelines that have been outlined and are a part of many of the resources that are provided in the handout. So in terms of the websites, a lot of them list the stepwise process that I'll go through with you guys. So at this point, medical doctors should really choose the system that they're comfortable with. So you really want your child, especially if they're athlete, to be in contact with the doctor and not return to play until the doctor advises them to. It's really just prudent to choose a guideline that errs on the side of caution and really be conservative. So a player should never return to play while symptomatic. Again, that 1 to 2 period after symptoms have completely resolved is really important. And the key is, when in doubt, just sit them out. So in terms of this stepwise process, these guidelines here have been adapted from the Canadian Academy of Sports Medicine, and they were outlined in May of 2000. So again, it's this gradual stepwise process for return to any sort of sport. And what's important to note is that as your child or adolescent's going through the steps, is they're only going to proceed to the next step if they're completely symptom-free. And if their symptoms do occur during a step, to drop them back a step or two when there are no symptoms, and then try to progress again. So again, just kind of feeling it out and noting when, really just having a monitoring system in place and making sure you're not going too fast during the recovery process. So the first step is really complete physical and cognitive rest, and the objective here really is recovery. And then once they're feeling good to move on to the next step, it's going to be light exercise such as walking or stationary cycling. The objective here is just to increase heart rate, so it's going to be about less than 70% of their maximum predicted heart rate during this second step. In the third step, they're going to start to introduce some sports-specific activities, those things like skating and hockey or running and soccer. The objective here is to add movement, but it's important that there's no head impact activities at this step. In step 4, they're progressing to more complex training drills, so passing drills in football or ice hockey. And the objective here is exercise and coordination and kind of increasing that cognitive or thinking load during activities. During the 5th step, the following medical clearance, again, it's important that they're going to get medical clearance from their physician. They can start to participate in normal training activities, and this is going to help them restore confidence and assess functional skills by the coaching staff. So as long as their coaching staff is also aware and monitoring their symptoms as well. And then once they're ready to return back to full activity in their sport. And now we're just going to get into preventing concussion. So again, it's really, really important to be educated about preventing concussion, but also to know that children that have suffered any sort of head injury in the past are at a higher risk of suffering a subsequent head injury. And as we were talked about earlier in the presentation, these multiple injuries can really lead to a longer recovery period. So we want to do as much as we can to prevent further injury or concussion from occurring. So the best way to prevent a concussion is probably a no-brainer, but it's really just by taking care of your head. And the following steps are ways to protect your child or adolescent's head or brain. So wearing a seatbelt is really important. If they're under the age of 10, they actually probably need a booster seat in the car seatbelt to hold them in properly in case of an accident. And children actually need a booster seat until they're 4 foot 9 inches in height and usually 8 to 12 years old. So people may not know that, but booster seats are important to ensure that they're secure in their car. When walking, of course, ensuring your child looks both ways before crossing a street and making sure they obey traffic signs and crossing only at crosswalks. Also important to ensure that your child always wear protective equipment like helmets when they're doing any activity where they could fall and hit their head, so any sort of high-risk sports. And it's important that the equipment be worn properly and replaced when damaged, and we'll talk a little bit about proper helmet safety as well in a minute here. So again, just making sure your child does not return to play while they still have symptoms. Again, that 1 to 2 period after symptoms have resolved are really important to note. And ensuring that if they're going to be returning to play, that they practice safe rules. And they're also very respectful of other players while they're playing sports, and no hitting to the head or hits from behind. But also you can make your living area safer for children by doing the following. So perhaps installing window guards to make sure young children aren't going to fall out of any open windows, using safety gates at the bottom and top of stairs when young children are around, keeping stairs free of clutter or toys, securing rugs or using rubber mats in bathtubs, not allowing children to play on fire escapes or in other unsafe areas where there's some sort of risk for falling, but also making sure that at their playground that there is some sort of material that can cushion falls when they happen. So things like hardwood, mulch, or sand, and it's also important to ensure that mulch or sand is actually maintained to a safe level that's going to be actually able to cushion falls. And in terms of playground injuries, again, some safety statistics and facts from the Brain Injury Association of Nova Scotia website. Each year, more than 28,500 children in Canada are treated by hospitals for playground injuries, and falls actually account for 3/4 of those injuries. Children 5 to 9 years of age are the most frequently injured on playgrounds, often because they're going up to higher heights on playground toys, but also because they lack a sense of danger and can be maybe a little more impulsive when they're out on the playground. And a typical injury for a 5 to 9-year-old is a fracture after a fall. It's important also that if your child is wearing a helmet, to take that helmet off before they play on any sort of playground equipment, because it can get caught on equipment and can cause your child to be strangled. So just looking at proper helmet fit. Again, this picture was obtained from the Brain Injury Association of Nova Scotia website. So on the left there is the right way to wear a helmet. On the left, or on the right here is the wrong way. That's difficult given the right and wrong there. So it's important to try on the helmet before you buy it and have it properly fitted in the store, and looking for safety approval stickers inside the helmet too, to ensure that they have been properly approved by some safety board. It's important to find the correct size, so you want to adjust the plastic straps so they sit just below the ear, and the chin strap should be snug without pinching your child. The helmet should fit snugly and completely levelly on their head, as you can see on the left-hand side there. So you can try and slide the helmet off, and it should not slide from the front to the rear or from side to side. It should fit quite snugly on their head. And it's also important that helmets can be brightly colored so that they're much more visible for people to see your children when they're out in the street. And also to replace a damaged helmet. There's a bunch of helmet safety boards that recommend a 5-year replacement of helmets. Again, no real scientific evidence behind this. More or less, it's that plastic is plastic and it can deteriorate over time and be damaged, but also that there is technology that improves over time. So after a 5-year period, there could be some improved technology, and you might want to access a better helmet for your children. So again, just kind of testing that out and seeing if new technologies come up. But of course, if a helmet is damaged or cracked at all, then you definitely do want to replace it. It's also important to think about the kind of helmet you want for your child too. Obviously, a bike helmet is going to protect from that vertex impact, so really just the top of your head, but a more multi-purpose helmet, like a motorcycle helmet, is going to protect both the top and sides. So thinking about what kind of helmet would be proper for your child as well would be important. And just in terms of follow-up, so if significant changes in learning or behavior are noted and they continue after 3 months, so there's some suspicion of this persistent post-concussion syndrome, a referral may be made to the IWK neuroresponse team, and the number is there for any further assessment or consultation. And in fact, a neuropsychological assessment may contribute significant information in concussion evaluation and management for those children that have suffered from persistent post-concussive syndromes or symptoms. And in fact, if physical changes are interfering with school attendance or performance, it's important to contact your family doctor to help in terms of that. Just to make sure, I think you guys all have a handout, but if you want, there's certainly one there at the back, but there's a bunch of references and resources at the end of the handout here. So they're split into different categories. So there's some information websites for families and youth here. Again, the Brain Injury Association of Nova Scotia website is there. In terms of the bottom one, the Brain Injury Association of Canada, it actually outlines the different associations for different provinces. So if you have any clients or anyone, if there's a health professional here, they can always go to that website and find the website specific to their province. There is some information about preventing concussion on the following websites in terms of the helmet initiative there. If you want to learn more about helmet safety, that last one there is good. There's some resources for schools, particularly for educators. The government of BC put out a really great resource guide for school, as did the Ontario Brain Association, and it really provides a lot of guidelines for supporting children after brain injury when they're back at school. There's some resources for return to sports for kids as well, and families. And the last one here actually just came out. So Keith Primo is a hockey, was a hockey player for many years, and that website just came out not long ago, I think. Is that right, Joan? Yeah, so that's actually a great one. I just took a look at it the other day. This is obviously a very busy slide, but there's some references for health professionals here, and of course there's more, if there's any health professionals in the crowd that would like some more information specific to children and adolescents. There's unfortunately not a lot of literature out there for children and adolescents that have suffered from brain injury, but there are some really good resources here for health professionals, and if you're interested, I can provide you with more. So don't be overwhelmed, but that's just a few that are on the slide there. And now it's time for questions.
If there's any questions from any of the telehealth remote sites, by all means, you can pose your questions to us here in Halifax. If there's a microphone on the table in front of you and there's a red light on it, if you press the button in the center of the microphone, the red light will go out and we'll hear you in Halifax. So by all means, if you have any questions, speak now.
Yeah, maybe not.
I have questions.
Hi, it's Truro. Wondering, what do you think about the concussion-proof helmets for hockey?
What do I think about the concussion-proof helmets for hockey?
Yeah, they're helmets.
I actually don't know a lot about them. I know that there are some very expensive helmets for hockey players. I don't know if anyone in the crowd here knows more about them. I don't particularly know a lot about hockey helmets in particular, but again, just making sure that they are safety approved is going to be important for any child or adolescent playing an impact sport.
Okay, great, thanks.
Yeah, sorry about that. I don't actually know anything more specific than that. You may be able to find information about that, though, on some of the websites. There are some specific to hockey. So I would take a look there and see if there's any information on some of those websites.
Hi, I have a question.
Mm-hmm.
I have a question regarding the sport of rugby. I wonder if you have any statistics on head injuries in rugby. And for instance, they don't wear helmets. They just have this little leather hat they put on so their ears don't look like cauliflowers.
Right.
But I wonder if you have any statistics. I know there is a lot of head injuries, and children like at the high school level, I don't really think they're tuned in as to what, exactly just how dangerous that sport is.
Yeah, no, I totally agree with you.
Thank you.
I don't have specific statistics to rugby, but certainly that particular sport does come up as listed in a lot of the literature as being a high impact sport. So it is surprising that helmets aren't used. But again, as noted, I mean, helmets are only one way to protect your head, and a concussion can certainly occur with an indirect hit to the body. So yes, it could be important in preventing injury, a helmet, but it's not going to be the only thing that's going to prevent a concussion. So it's one of those sports where, the guidelines and just information for coaches and players are going to be important to respect other people on the field and making sure there aren't any direct hits to the head or hits to behind that are going to be surprising to another player. So yeah, it's I don't know if there's any initiative that will ever occur in the future with regards to helmets, but again, helmets aren't the only thing to protect people from concussion. So
Thank you very much.
yeah.
Any questions here? I have a microphone so that everybody telehealth land. Good question.
No? Yeah, absolutely.
Is it on? I'm not sure if you'll be able to answer this, but I noticed a lot of the behavioral symptoms you talked about with post-concussive syndrome. I work with children with special needs and behavior problems. Mm-hmm. So a lot of the symptoms you mentioned, they already exhibit on a regular basis. Yeah. So I guess I was just wondering what would be in determining, and some of those kids too are the high-risk ones for falls and head injuries too. So yes. I guess I was just wondering what are the most what are the symptoms you should really focus on when it comes to
change is going to be the big thing, because you're right, a lot of things, and like I was saying, they're common in even healthy individuals, the typically developing population, and you're right, specific populations, they're going to be even more prevalent, those kind of specific symptoms. So you don't want to necessarily look for specific symptoms per se, but especially if you're already exhibiting those things, but change. So are their symptoms worse? Are they exhibiting more difficulty? Are they having difficulty in areas where they before? So that's what I'm looking for is they're already exhibiting those kinds is the change.
Okay.
Yeah.
Thanks.
Hi, can you hear me? This is from Bridgewater. This is a specific question about a 13-year-old 3 weeks post-concussion. Mm-hmm. Now, his only symptom that's remaining is the occasional dizziness when he gets up. Mm-hmm. Otherwise, he's doing fine. Okay. Would you still classify that as being symptomatic? And would you recommend that he is completely free of dizzy spells before he's reintroduced back into the steps of getting back into sports?
I would definitely consider that a symptom. If he was not experiencing dizziness beforehand, then absolutely, it's still a symptom. It's one of those things where you can start with some gradual. I mean, again, I think you should probably talk to a medical doctor, but we really do recommend that there's no return to sport at all, 1 to 2 weeks after they're symptom-free. But a gradual, the medical doctor may request some sort of gradual transition. So even just trying something like running or just some light walking or cycling just to see if the symptoms worsen or increase. So I'd recommend that they talk to their family physician. But certainly if dizziness is still occurring, then that's the symptom. It's definitely a symptom. So yeah, okay, it's always to err on the side of caution. Yeah.
Thank you.
Yeah.
Oh, she got that.
Everybody wants to just get back out in that rain, hey? Yeah, of course.
Just wondering on page 5 of the handout that you gave in. It says most people will fully recover without any permanent or long-lasting symptoms. Just wondering, how was that established?
Well, it's really people that have presented to some sort of medical doctor or emergency room, and they've been monitored over time. So it's really just based on and it's not based on a child and adolescent population, but everybody that suffered from concussion in the literature. Yeah. So does that answer your question, Helena? Yeah.
Yeah, we see this in physiotherapy. We see this with back pain. They say, well, everybody gets better after 1 year or 2 years, and it wasn't that they got better. It was that they gave up on going to the doctor to seek help. They still had it,
Right.
5 and 10 and 15 years later. So
Right.
just wondering, that's where my question came from.
Yeah. You're right. It's based on people reporting their own symptoms. So it's, yeah.
Yeah, I just wanted to point out, I think it is people reporting their symptoms,
Yeah.
but these would be research studies where they would be following, so they would be calling people up and
Exactly.
saying, giving them a checklist, what symptoms are you having now? So
Yeah.
it wouldn't be that they're actually, having to come in and report the symptoms.
No.
They would be monitored more
Yeah.
carefully
Yeah.
for symptoms.
Yeah.
That's correct.
Oh,
Kate?
absolutely. Yeah.
But good question.
Yeah, definitely. And it does vary. Recovery is very different for everybody. So they kind of say around 7 to 10 days, and that's more for an adult population. For children, it can take longer. Children, adolescents. So yeah, it's going to be different and important to monitor over time. So.
Is there any role with the mild TBI population for the traditional therapies like physio, OT, speech, any of those, or is it pretty much just rest across the board and recovery?
I think it's really just going to depend on the person. If they're experiencing any significant difficulty in those areas, then I don't see the reason why they shouldn't access those kinds of services. So it's going to be really on a person by person basis, and especially if they've had previous concussions, then there could be more complicated problems that are occurring, and they may really benefit from those additional supports. Yeah. Anybody else?
Hello, Amherst here.
Hi.
Sidney Crosby, if I may ask, what would his rating on your scale be, and what would you see as project as his prognosis?
It's a good question. I would not want to answer that because I have no idea. But I don't know. I don't know what his situation is. I have no idea how many concussions he suffered in the past or what this particular one looked like. But I figured if anyone's going to have a question about hockey, it'd probably be around Sidney Crosby tonight. So I don't have a good answer for you, unfortunately.
Thank you.
Yeah, no problem.
If nothing else, Sidney Crosby has brought more attention to
Oh, absolutely. Yes, the increased awareness. Yeah.
Open the Globe and Mail without some article on concussion. I'm sure a lot of it is Sidney Crosby's.
Absolutely. Yeah. There are some benefits to big names and in the sports field, increasing awareness, so people can be more educated about those symptoms. Sorry, I don't have a better answer for you. I wish I could say he'd be back in a week, but it's probably not going to happen. So.
So what happened to Sidney Crosby exactly?
Well, it was an injury during hockey, and he hasn't returned to play. So.
When did that happen?
It happened quite a few months ago now. Yeah, he hasn't been in the playoffs at all. So, yeah. So it's quite a blow, of course, to his team because he's quite a good player. So, yeah.
2 hits for 35 days. So there's probably for the first one was.
So I know the situation. So there you go. I mean, as we know, those close in time, Yeah. And you've seen it certainly with younger hockey teams nowadays. I don't think they even allow hits until the age of 13 in hockey, if I'm correct. There have been a lot of regulations placed on younger hockey players because of the increased awareness of concussion during these kinds of impact sports. So it's good to know, but I mean and I don't foresee hockey probably being a non-contact sport in the future, but in some ways it would be nice if it was to protect their heads. So, yeah.
From Bridgewater again, do you have a specific scale that you use in determining the symptoms of a concussion?
No, it's going to be different for everybody. Again, there's, like I was saying here, there's really different, even different diagnostic criteria depending on who you go to. So it's really going to be based on the report from the individual, and some people may be just experiencing a couple of symptoms or one or two, and others may experience a whole bunch. So it's really very variable depending on the person and what the hit was to the brain.
Okay,
Yeah.
thanks.
So I don't have a more specific answer, but yeah, it does vary. It varies quite widely from person to person. So.
Okay.
Are the symptoms more severe in males than females?
Well, as I was saying, there's actually some literature. Well, male concussion is more common in males than females, which is probably not surprising given a lot of the high impact, risky activities that they can be involved in. But there is some research to suggest that females can actually suffer kind of more long-standing, complicated problems following concussion. Again, it's not a large body of literature. It's something that's kind of coming out right now, and there's not a lot of literature specific to children and adolescents. But it's certainly a factor that if you are a female, you may be at increased risk for a longer recovery or more problems following concussion. So, well, it's a variety of kind of hypotheses in the literature. One suggests that maybe the actual neck is not as strong, so when they sustain a hit, that their brain could be jostled a bit more in their head. I'm not entirely. There's not a lot, so I really don't know. It could be something more chemical. I'm not too sure. If anybody else has any, do you? Yeah. There's not a large body of literature out there yet. It's just kind of one of the people are saying, yeah, it's a factor, but even that panel with the table I was talking about, they considered it, but it wasn't strong enough literature to even put it on as a factor for them. They just thought, it's something to consider, but it's not a for sure. So there's no guarantee, male or female, if you're going to take longer to recover. But there are some instances where it does, where in females it does take longer.
Okay, thank you.
Yeah.
I was just wondering about, this myth around like following a concussion that the person's not supposed to sleep, and I was just wondering if that was true.
That they shouldn't go to sleep at all,
yeah.
Right after. Well,
yeah.
I think the one thing is that people just want to make sure that they're monitoring their symptoms. So if they're sleeping, then that's not going to be very easy to do. But again, it's also maintaining that consciousness level so that they can be assessed more properly.
Okay. So it's not that it's necessarily going to be damaging for them if they are. It's just that they want to make sure.
Right, and especially that they get into a medical professional. So you want to make sure that they're, if they are feeling dazed or they're not actually able to sustain consciousness, that they certainly get into an emergency room to assess if it are unable to maintain consciousness because something else is going on, because there's some rapid swelling in the brain or there's some bleeding or something's happening. So you want to make sure that in that case, that they're actually seen by a professional. I think in some cases, kids may get a hit to the head, they go home, they're not seen by anybody, their symptoms really aren't monitored, and it's never known whether or not they've actually sustained a concussion. So really seeking that medical attention is key to make sure that their symptoms are monitored and that they are supported appropriately. Yeah.
Hello.
Yes.
Would you speak of coup and counter coup about duration and severity of injury?
So are you talking about a specific criteria, you mean, or?
Yes, for the same level of impact, if there was a contra coup injury, would that be more severe or be of a longer duration before healing process?
Again, there's such a range of factors that contribute. So coup contra coup damage essentially is when the brain moves forward or backward into the head and then moves back. So it's getting kind of hit on both sides. So the impact is forward and then directly opposite on the same side, and the head moves back. Again, there's so many different factors that contribute to recovery, like I was going through, that it's hard to say. Certainly it is a factor if how severe the injury was, but there are many other things that do contribute. So I would just take a look at that handout on that table and the page following. There's many things that contribute to recovery and how long it takes a person to recover, and it's certainly not just injury severity.
Yeah, thank you.
Yeah.
Hi there.
Hi.
Just a question. How long should you let symptoms continue before you are actually have your child assessed by a neuro? psychologist?
It's a good question. Again, because recovery can take a little bit longer for children and adolescents, what we recommend is if symptoms are persisting beyond that 3-month period, to then perhaps look into a neuropsychological assessment. We don't recommend that everyone be assessed because we don't have the resources for that, but certainly, if there's major concern after a concussion, then a private neuropsychological assessment can also be accessed, and that can, you can be referred through a family doctor. But what we recommended here at the end of the presentation is about if there's, problem continuing past that 3-month period where we would expect the majority of children and adolescents to have had a complete recovery, that at this stage we would request that a neuropsychological assessment could inform some supports or information that could help manage with symptoms and things of that sort. So,
Thank you.
Mm-hmm. And there's a number too for the IWK on that final slide as well for the neuroresponse team. So if there was any concern about wanting to see how you could refer, certainly always a family doctor can refer for a neuropsychological assessment, but you can call that number yourself as well as a parent, or if you wanted to refer your child for that kind of assessment. So did you want to add anything to that, Joan?
I think the number that's on there is actually the nurse coordinator for the neuroresponse team, but she could certainly give information about how that referral would be made.
Perfect. Okay.
And I think from my reading of the literature, often a formal neuropsychological assessment may not be necessary because a lot of the time it's just looking functionally at where the child or adolescent is having difficulties and coming up with the right kinds of supports and adaptations. So that investing a huge amount of time and money, I guess, doing a formal full-day assessment is not always necessary. But, if there are concerns, even if an assessment isn't done, there are individuals on that team that could provide that kind of support to the school and family. And in terms of coping with some of the cognitive thinking, behavioral issues that come up. So even if there isn't a full assessment, there could be some additional consultation.
Oh, absolutely.
Could be provided.
Yeah.
Thank you.
Where to ask,
Good question.
Supports, yeah, definitely.
Yeah. Shortly soon with the telehealth system anyway.
All right. I was giving you science.
Yes.
Anybody else? Any other questions? So again, because we're preparing these brochures, if anybody is interested in helping us to review, so we've got brochures that we're preparing both for children and adolescents, for families, and for educators in schools. If you'd like to take a look at them and give us some feedback, we'd be really grateful. So if you could provide us with your email addresses, it's just on the way out the door there, that would be fantastic, just to get a sense of how helpful they are and if there's any language that might be difficult to understand, or any other things that you might want to recommend to us. That'd be great. So. All right. Thank you all for coming on a rainy evening. I appreciate it.
That concludes telehealth from Halifax. Thank you all for coming tonight, and have a pleasant evening.